The worst thing that can happen to you is to see someone so dear to your heart in front of you, in pain, crying, and even unaware of your presence. I still remember that day very well. We were all sitting around my grandfather. We knew it was coming. We were talking to him, but he wasn't listening to us. He couldn't hear us because he was in so much pain. It was so hard on all of us, especially that we knew about palliative care so late through a friend of my mom and not through his physician, and we were not able to pay for all the expenses since it was not covered by insurance nor Daman. We all went through difficult times, especially my grandfather.
Do you know what palliative care is?
No. Just to ease the pain?
No, I don't.
About what? No idea. No idea.
Palliative care?
No.
Actually.
Yeah?
Out of 20 random subjects that were asked this question on the streets of Beirut, only 2 knew what palliative care is. A research that was commissioned by the Center to Advance Palliative Care explored the awareness and understanding of palliative care of 800 adults and showed that 70% were not knowledgeable at all about what palliative care is. What is palliative care?
Palliative care is a medical approach that focuses on improving quality of life and relieving suffering in patients and families. So we don't just focus on the patient, we focus on the people around the patient. And we focus on not just the biomedical or the physical dimension, but also the social, the psychological and the spiritual dimension, because a serious illness affects all of these dimensions. So the idea is we try to take care of patients to relieve their suffering and improve their quality of life despite their illness.
I don't see why not.
People need that.
Like, why would someone say that I don't want to help?
Yeah, why not? أكيد definitely.
Yeah, I recommend it, yeah. Yeah, very useful.
ايه ليش لا؟ إذا كان يعني هو أهم شيء واحد يخفف الألم.
But why is palliative care still not widely present or even acknowledged in Lebanon?
We worry that if we increase demand and people know about this kind of care when the services are not yet available in the country, then you're actually increasing suffering. The main obstacle among healthcare providers is a lot of them don't understand the concept of palliative care either. So some people will not refer a patient to palliative care until they're dying because they believe that as long as they're receiving curative care, they're not candidates for palliative care. So a lot of doctors don't understand the concept, therefore they don't refer. And of course, many doctors fear losing their patients if they refer them to palliative care, when in fact what should happen is the palliative care physician and the treating physician should work hand in hand to take care of the patient. It's still not covered by insurance, so when you want palliative care, really it has to be out of pocket or there's charity coverage, which is what we do, it's covered by charity.
We asked Dr. Deborah, a hematologist-oncologist attending physician at AUBMC, when they resort to palliative care with their patients.
So as a medical oncologist who's trained in the UK, I think that palliative care is a very important part of our care of the cancer patient, and we try and introduce the concept at a very early stage. So palliative care, in my view, is not just for patients who are at the very end of life, but it's really to help the patient and their family with the treatments that they're going through, with symptoms related to cancer. So I think as early as possible in the patient's treatment journey, we should introduce palliative care.
Are patients or families accepting with the idea of palliative care?
It very much depends on the patient and their family. Often it takes a lot of work to describe to the patient and the family exactly what palliative care is. So it's something that's not widely known about in the community or even in the hospital. So I think we often talk about palliative care at the end of life when patients are clinically deteriorating, and at that point it's very helpful to introduce the palliative care team as a help for the patient and their family alongside the oncologist.
What obstacles do you face in Lebanon regarding palliative care?
So I think that's probably a lot to do with awareness. That's to do with awareness at the national level, and I know that members of the Palliative Care Committee at AUB are involved in national discussions about palliative care, about opiate prescribing, opiate availability. So there's discussions on the national level, and then community work. So that's done often by NGOs. There are some excellent NGOs providing palliative care services in the community that are affecting and really helping patients on an individual level. And then community work by AUB and other hospitals, conferences, educating physicians and nurses and other healthcare professionals. So I think it's on lots of different levels that we can really help to get the message out there that palliative care is really a beneficial thing for patients. There's lots of studies in the US showing that it can actually save money, it can actually lead to better outcomes when palliative care is introduced early. So I think if patients, families, physicians, nurses, insurance companies and hospitals get that message, then that's something we can really work on.